Jai Hind. Due to ongoing pandemic disease, novel coronavirus or COVID-19, our India and all the world is facing an extreme condition of loss of life. So today, I am present a topic named health and hygiene to aware people to keep yourself safe and protected from that pandemic disease. So starting with the topic health and hygiene, first of all, we must know what is the meaning of health. The slide is showing the definition of health. Health is defined as a state of complete physical, mental, and social being, and not merely an absence of disease or infirmities. We can say that a organism physically fit, mentally stable, social well-being, and merely an absence of disease or infirmity, we are called that a healthy organism. Recently, WHO is adding a new word, that is spirituality. What it's meaning? That the particular organism must practicing yoga, pranayam, meditation once in a day, that must be a healthy organism. Physically health and mental health are interrelated. A sound mind in a sound body is an old and appropriate saying for good health. And one of the quota about health is, don't wish for your perfect life, wish for your healthy life. A healthy human being has generally the following features: a clear skin, must take bath daily, bright clear eyes, a body neither too fat, neither too thin, fresh breath, good appetite, sound sleep, having 8 hours sleep in a day, regular activities of bladder and bowels, means having good digestive system, good respiratory system as well as excretory system, and all the body movements, all the body functions are working in a much coordinated manner. What is the difference between a healthy organism and a disease-free organism? Here I just want to mention you that is a disease-free organism is not a healthy organism, but a healthy organism must be a disease-free organism. A disease is a disformity or discomfort by which the organism is having some discomfortability, but a healthy organism is physically, mentally, and social well-being. It refers to only the individual, while health is the social environment. Health, the individual having good health, while the disease-free organism having good health or poor health. I already mentioned here that a disease-free organism is not a healthy organism, but a healthy organism always is a disease-free organism. What does disease look like? When a person is affected by a disease, either the normal functioning or the appearance of one or more symptoms of the body change for the worse. The change gives rise to the sign of the disease called it symptoms. A disease appearing in our body, first of all, the symptoms are appearing in our body. On the basis of symptom, the physician look for the sign of a particular disease and conduct tests to confirm the disease. When we fall sick, we are going to visit to a physician, to a doctor. First of all, he or she will take some test, our pulse rate, our breathing pattern, and then we will or she will conduct some test and identify the particular type of disease. Next one, that is the type of disease. Diseases are of different types. First one is that is the acute disease, or disease which lasts only for a short period of time and does not have long-term effect on our health, like cold, cough, typhoid, cholera. In this disease, there is no effect on our body, there is no loss of weight, no academic performance down. We do not take any leave from our professional front, from our professional duties. While in chronic disease are diseases which last for a long time and have long-term drastic effect on our health. like diabetes, tuberculosis, elephantiasis, arthritis, cancer. In this disease, loss of weight, loss of appetite, academic performance down, we can take leave from the school or from the professional front also. Next one, that is the infectious disease, also known as communicable disease, are disease which spread from an infected person to a healthy person through air, water, food, vector, physical contact as well as sexual contacts. For example, common cold, chickenpox, mumps, measles, typhoid, cholera, tuberculosis, malaria, AIDS, and recently coronavirus COVID-19, which was originated from the Wuhan city of China, and nowadays which is highly pandemic all over the world. Next one, that is the non-infectious disease or non-communicable disease. Are diseases which are not spread from an infected person to a healthy person. For example, beriberi, ricketts, scurvy, night blindness, diabetes, cancer, high blood pressure. These diseases may be caused due to the deficiency of vitamins, minerals, etc. Next one, we are studying with the cause of disease, how a disease caused to our body. It may be caused by a virus, like we are already talked about the novel coronavirus or COVID-19, bacteria, fungi, protozoans or worms. Poor health and undernourishment is also a significant factor which is causing disease. Nowadays, Ayush Mantralaya is also telling us so many remedies which is helpful for improving our good health. If we are having a poor health and not taking a good food, we must be get hijacked by a number of diseases. Third one, that is a malfunctioning of the body parts, if our body part is not functioning properly. Fourth one, that is the environmental pollutions. And fifth one, that is the genetic disorder. If the parents, if a father or a mother having a disease, that disease may be transferred from one generation to the another generation, like hemophilia or sickle cell anemia. Infectious disease are caused by the infectious agent, maybe virus, bacteria, fungi, protozoan or worms. Infectious agent like virus causing COVID-19, novel coronavirus, common cold, influenza, measles, mumps, chickenpox, AIDS, hepatitis B, etc. Bacteria, cholera, typhoid, tuberculosis, tetanus, anthrax, food poisoning, etc. Fungi, all the skin diseases like scabies, itching, protozoans, malaria, kala azar, amoebic dysentery, sleeping sickness, worms, intestinal infections, as well as elephantiasis are caused by the various type of platyhelminthes and S. helminthes. Means of spread of disease. This is how disease spread. They may be spread through air, common cold, tuberculosis, pneumonia, COVID-19, through water, cholera, amoebic dysentery, through vectors like mosquitoes, malaria, dengue fever, yellow fever, flies like typhoid, tuberculosis, diarrhea, dysentery, through sexual contact like sniffles and AIDS, that is acquired immunodeficiency syndrome, a disease which is acquired by the organism in his or her lifetime, in which loss of immunity, deficiency of immunity is taking place, and a number of diseases get hijacked by that person. That is known as syndrome, acquired immunodeficiency syndrome. AIDS virus can also spread through blood transfusion and from the mother to her child during pregnancy and through breastfeeding. These are the various measures to protect themselves from this disease, like washing your hand nowadays. As we very well know about the COVID-19 coronavirus, we must Wash our hand properly at least 20 seconds from any soap or a hand wash. Good hygienic food, good hygienic basis. When we are taking, when we are having a hygienic environment, we can protected from that particular disease. And good healthy or good food, when we are taking a good food, we inbuilt our immunity inside our body, and we are taking a bad food like junk food, french fries, burger, pizza, our immunity is weaker day by day. So doctors or the health practitioner are always advised to take good food, a healthy food to human your immunity. So now starting with the hygiene. What is the meaning of hygiene? Hygiene refers to the condition and practice that help to maintain healthy and prevent the spread of disease. When a particular organism is having a hygienic environment, he or she taking daily bath, taking care of their personal hygiene, he or she may fall sick. Medically, hygiene therefore includes specific set of practice associated with the preservation of health. Means the particular organism having a good hygiene, having a good immunity, we can say that. Eat healthy food. The slide is showing various type of green leafy vegetable, fruits, various type of another substances, another food, vegetables, fruits are showing that which is a healthy food and which is helpful for maintaining a good health as well as good hygiene. Now the importance of hygienic practice, as the slide is also showing, it improve our health. Good hygienic condition, a good hygienic practice is meant to improve our health. It makes people admire at you. When you are having clean clothes, having the peoples are admire you. If you are clean, the action is also clean for you. Makes the environment clean, easy flow of verbal communication and discussion. When you are having a good hygienic practice, you are having a good communication as well as discussion. It helps to improve hygiene in you also. It enhance self-discipline also. People learn from you about your secret of success. When you are having a good hygienic practice, you never fall sick, means you can achieve something good in your life. You are the winner of the competitive work also. Hygienic practice, how you have to do? Keep your workplace clean. Keep your tools, instruments and machinery clean. Keep your office files clean. Never allow dust accumulation. Never shy in cleaning your tables by yourself. Use toilets in proper way. Use more water to avoid smell and stain. Wash your hands and mouth after you use the toilet. Always close the door of toilets. Open the doors of ventilation. These are the various points which are showing a good hygienic practice. So by doing this, we can maintain a good hygienic environment. Now this is the quiz time. We are having various number of questions by which we can do for COVID-19 or coronavirus. First question: what are the common symptoms of COVID-19 or novel coronavirus? A new and continuous cough, fever, tiredness, all of the above. What is the common symptoms of COVID-19? A new and continuous cough, fever, tiredness, all of the above. Nowadays, everyone having the Arogya Setu app in your mobiles. When we are going to the self-assessment test, the first question in the self-assessment test that how are you experienced? You are having cough, fever, typhoid, or all of the above, or none of the above. So, what is your answer, dear friends? I think that is the fourth one, that is all of the above, that is the common symptoms of the coronavirus, means cough, tiredness or fever. But nowadays in Delhi, capital of India, the various patients are identified with asymptomatic symptoms, that is not showing any symptoms. So we must have such type of problems. Can you always tell if someone has COVID-19? First one question is, can you always tell if someone has COVID-19? First one, no, not everyone with COVID-19 has symptoms. I already mentioned you in Delhi, a number of patients are identified which is do not showing any type of symptoms. Second, yes, it will be obvious a person with COVID-19 cough a lot. Yes, it will be obvious a person with COVID-19 cough a lot. Third one, yes, you can tell just by where a person comes from, their race and ethnicity. Try to understand this. Yes, you can tell just by where a person comes from, their race and ethnicity. So what is the answer of this question, dear students? The answer of this question is the first one, not everyone with COVID-19 has symptoms. I already mentioned a number of times, that is nowadays the patient do not have such type of symptoms like cough, tiredness, fever. So they must have to go if they are come in contact with a COVID-19 positive patient, they must have to go with the test of the COVID-19. Next question, that is the question third. Can washing your hands protect you from COVID-19? Try to understand the question. Can washing your hands protect you from COVID-19? First one, yes, but only if you use a strong bleach. Second, yes, normal soap and water or hand sanitizer is enough. Third, no, washing your hand does not stop COVID-19. Try to understand the question. Can washing your hands protect you from COVID-19? And the answer is, that is the second option, yes, normal soap and water or hand sanitizer is enough to protect themselves from the COVID-19. At least 20 seconds, wash your hands, all the parts of your hand you can wash with a normal soap or water or a hand sanitizer to protect themselves from this disease. Starting with the fourth question, try to understand the question. Which of the following people is COVID-19 more dangerous for? Select all correct response. Understand the question. Which of the following people is COVID-19 more dangerous for? Select all correct response. First one, children. Second one is older people, especially then those aged 70 and above. And third one, people with certain underlying health condition. And fourth one is European people. Try to understand the question. Think about it and give the answer. The answer is third one, people with certain underlying health condition, means the people which is do not having good health, having a weak immunity, they may be fall sick from that particular disease. Question number 5, last one but not the least. Are people living with HIV always more at risk? Yes, people with HIV has weaker immune system. No, people who adhere to antiviral treatment are and have a high CD4 count are not more at risk. Try to understand the question, and the answer is, that is the second one, no, people who adhere to antiretroviral treatments and have a high CD4 counts are not more at risk. The antiviral retroviral treatments and CD4 counts are the technique which is used to treat AIDS patients to boost their immunity and they can protect from themselves from that particular disease. This presentation is dedicated to all the medical warriors, all the medical staff. They are facing this disease and are the front warriors. Hope you have learned from this. For any question, any queries, you can email us, that is kandarapawan@gmail.com. Thank you so much. Have a nice day.